about the vagus nerve and why we may want to give it a little bit of stimulation. Now, to perform vagus nerve stimulation with a Mihealth device, you're not only going to need the Mihealth, but you'll also need a 3.5 millimeter Jack 10s cord that has 4 pins at the end. And you're also going to need 4 little 10s ear clips. So we have 4 leads here, 2 positives and 2 negatives. What you're going to want to do is plug this cord into your Mihealth device, and then you're going to need to calibrate these electrodes to your Mihealth device. Only, as you guys should know, you cannot calibrate your device if anything is touching the electrodes. And since these are clips that you open and close, the little clip on the end is always touching that electrode. So you just want to position them inside of your hand in a manner in which you can use your thumb to open all 4 of the clips at once. Then you want to go in to your settings inside of the Mihealth device. Go to calibrate electrode, and since we have an external electrode plugged into the device, it's showing calibrate external electrode. Go ahead and open all of those clips and press OK and calibrate your external electrodes to the device. Now that we have calibrated our ear clips to the Mihealth device, we can go ahead and prep our ears or the ear clips for the stimulation. Now this can be done by using a electrode gel that you can buy online in various places, or you can just use a little bit of water just to make sure that there is nice conductivity between the electrode and your ear. Next up, we're going to want to place the electrodes in very specific parts of the ear where the vagus nerve actually innervates. Those 2 areas are going to be the concha and the tragus. So you're going to do this on each ear. So you're going to want a positive and negative that are attached to each other for one ear, and a positive and negative that are attached to each other for the other ear. Go ahead and place one electrode with the pad on the inside of the ear on the concha. It's kind of the larger portion of the ear cavity. If you were to just stick your finger inside of your ear in the biggest part, that would be the concha. And then you have this little tiny part of the ear known as the tragus. Many people get this pierced, and it can help with migraines and headaches and those types of things. So that same area is where we're going to want to put the next ear clip, and we want the pad to be on the inside of the tragus. So go ahead, add that there. Go ahead and do the same thing on the opposite side. And now we are ready to go. Now we have to choose what setting we're going to use for the vagus nerve stimulation. There's a few that can be used, and we'll go over each one, but I would like you to only use these specific settings for this type of stimulation. Yes, many of our settings are very safe on the Mihealth device, but some of them go a little bit higher in frequency. So I've chosen very specific frequencies and settings that are within the ranges that have been heavily studied for vagus nerve stimulation. So please tailor your frequencies to these specific ones that we'll talk about, and only use them for this type of stimulation. This type of stimulation can be used for a variety of things. You can just do some general support with the cranial nerve's energetic rejuvenator. You can also do a little bit of support for the GI, the gastrointestinal tract, via immune ETs, digestion, and food. And lastly, vagus nerve can be good to support people that are in different types of widespread discomfort and pain. So for that type of use, we're going to want to choose matrix carrier, chronic balance, or biocell. One thing that you want to remember is that biocell can really jumpstart a healing response because it matches to all of our energetic terrains. So remember that when using biocell as well as immune ETs. So once we've determined the correct setting for your desired intent, we now need to find the perfect power setting for you. Now, with vagus nerve stimulation, it's going to be much lower than any other use of the Mihealth device because we are stimulating a part of a nerve that is peeking out right up inside of the skin. And you don't want to fry your vagus nerve, so to speak. So we want to use very, very low power, and you only want to use intensity level 1. So that would be intensity level 1 there. And then I'll go ahead and start the stimulation, and you're never going to go above 10% on the power level. So I'll slowly go up. Right at about 7 there, I feel a nice tingle in both ears. It's not painful. It's just a very slight little stimulation. You can do this for 5 minutes a day to start and work yourself up to about 10 to 20 minutes at the max. Any more really isn't needed. It's more about the repetitive nature. So if you can, do this every day or come in and see your clients once a week if you can, or even more often for people that you may feel that this certain type of stimulation may be a benefit. This video is for educational purposes only and is not meant to be taken as medical advice or a replacement for advice from your practitioner or medical provider. The NES Bioenergetics Wellness System is not intended to diagnose or treat any diseases.